we're focusing on bloodborne pathogens, specifically HBV, HCV, and HIV, for your phlebotomy exam. The exam will absolutely test your knowledge of transmission risk following a needlestick injury. It's crucial to know the hierarchy of risk. Hepatitis B or HBV is the most infectious, with a 6 to 30% transmission risk from a single contaminated needle exposure if you are unvaccinated. This is significantly higher than hepatitis C or HCV, which has about a 1.8% risk, and HIV, with a much lower 0.3% risk. Let's frame this with a classic exam scenario. A question might describe an unvaccinated phlebotomist who sustains a needle stick from a needle used on a patient with a known HBV infection. The question will ask for the most appropriate immediate action. While documentation is important, the first physical action is to wash the area thoroughly with soap and water. Following that, the incident must be reported immediately to begin the post-exposure protocol. A common exam trap is to present options that delay treatment, such as waiting for symptoms or simply documenting the event without seeking medical evaluation. The correct answer will always prioritize immediate cleansing and reporting. Now, let's talk about prevention and post-exposure management, as these are heavily tested concepts. For hepatitis B, the key is vaccination. The HBV vaccine is typically administered in a 3-dose series. A critical point often found on exams is the need for a titer check, which is a blood test to confirm immunity about 1 to 2 months after the final dose. If an unvaccinated person is exposed, post-exposure prophylaxis, or PEP, involves receiving both the hepatitis B immune globulin, HBIG, and starting the vaccine series, ideally within 24 hours. In contrast, there is currently no vaccine for hepatitis C. This is a favorite exam trick question. If a question describes an exposure to HCV, any answer choice involving a vaccine is incorrect. Management focuses on baseline testing of the exposed individual and the source, with follow-up testing to monitor for infection. For HIV, while there is no vaccine, there is an effective post-exposure prophylaxis protocol. The exam will test your understanding of its urgency. HIV PEP should be started as soon as possible after exposure, ideally within 2 hours and no later than 72 hours. To help you remember the transmission risks, use this mnemonic. B is bad, C is concerning, H is hardly. HBV is the baddest or most infectious at up to 30%. HCV is concerning at 1.8%. HIV is hardly as risky in comparison at 0.3%. Remembering this simple phrase can help you quickly answer questions that require you to compare the risks of these 3 major bloodborne pathogens. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.